will you go over the Craniocervical Syndrome?
Oh, yeah.
And how that relates to, this research?
Yeah, so just these doctors that wrote this paper. So the lead author is always the first guy on the paper. So Michael Freeman, he was the lead author. He is a medical forensic scientist, and he deals a lot with traumatology and whiplash and injuries, right? And so and we can circle back around to your comment about gravity, weight bearing, and possible damage to the upper neck and how that relates. But this is craniocervical syndrome. All these guys are in this world of craniocervical instability / craniocervical syndrome and how they relate. So Freeman is a medical doctor. Actually, Scott Rosa is the only chiropractor on this page. He was the only upper cervical. He is an upper cervical chiropractor, an Atlas orthogonal upper cervical chiropractor. And he was the second guy on the paper, so he definitely had a lot of a lot of input on the paper. And David Harshfield, he is a radiologist down south. I can't remember exactly where, but he also looks at craniocervical instability and does some regenerative therapies like injections. Not sure if it's Pro-Low or PRP. I think he does a little bit of both, maybe. But you'd have to look it up. But David Harshfield is he's a well-known radiologist that works with Scott Rosa. And then we have Francis Smith. He's another radiologist. Dr. Bennett, I don't actually know who that is, but I do know Christopher Centeno. I met him at the symposium we had last June, and he does regenerative therapies as well. He uses digital motion X-ray to see ligaments that might be either torn or damaged in movement in the neck. So they do flexion extension movement with the neck, and they look to see how the ligaments might be torn or damaged, as well as that upright MRI. So they use all these technologies to image the craniocervical junction, meaning cranial skull, cervical neck junction is right in between the two, and that's a black hole for the really the health community. These guys are the first guys to really get in there and look at it. So what they're doing is they're looking at what ligaments might be damaged and injured. Possibly there's a minimum of 7 to 9 ligaments in just right up here. It's 7 to 9 ligaments between the craniocervical junction, being the apical ligament that attaches from C2 up to the skull, the alar ligaments, which are cross-check ligaments that check lateral bending and rotation in movement, and so they keep your atlas attached to your skull in these movements. And what we find is that sometimes these ligaments are completely blown in some of these whiplash injuries, head and neck trauma injuries. And so when they go and dip their head or they tip side to side, the bone just goes whoop, like way off to one side. And so that's what we're talking about. And what happens then when you have instability in that craniocervical junction? That's where your brainstem is, and that's the tonsils, right? And so when they're different parts, but it's all part of that brainstem cerebellar tonsil area, it can dip down because of the weakness there. And so, I think that these guys were one of the first groups to really study that science, use this imaging in a way that they could diagnose and make treatment decisions better. And this is an emerging science. So if you or someone you know out there is suffering or struggling with head and neck traumas and injuries, having an upright MRI, having digital motion X-ray, having cone beam CT, having X-rays of the neck to see where the bones are at and how things are sitting is really important to help decide how to move forward.
Got it. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support.